have three speakers, and then we'll have the opportunity to have some discussion. So our next speaker is John Gearhart, who's the James W. Efron University Professor and Emeritus Director of the Institute for Regenerative Medicine at the University of Pennsylvania. Dr. Gearhart, thanks for joining us.
I feel it's going to be very short because much of what I had to say has been already said, but I'll find something. I wanted to remind the committee of something that I look around the room and there are a lot of investigators and people who helped us 17 years ago with the stem cell story to get through policy issues, and greatly appreciated. But I think it's important to point out that here we are 17 years later, and of the 3,000 plus open clinical trials at this point in time, only about 2 have any products of embryonic stem cell or pluripotent stem cells. Tells you the lead time that's necessary and the work that was necessary, and that's not hope. I hope we don't have to wait that long to see something like MRT come into place. For my COI, I have to tell you that I've had a pretty extensive experience running an ART laboratory at Hopkins for many years. I'm on a number of SAB boards, a number of regulatory places. I sit on the World Anti-Doping Authority, where stem cells are now being used extensively in athletes. There's now a great move among athletes to employ, not surprisingly, bioenergetics, and they're very interested in enhancements dealing with mitochondrial DNA, and clearly this is on the fast track, and it's moving. So you can say that you want nothing to do with that at the moment, but I'll tell you that this is moving. I wanted to emphasize several points that were made, and maybe add a little bit more to it. My experience, and I think many of our experiences in dealing with ART technologies, and Jacques obviously is a master at this, there's a lot of skill involved in this, and particularly in the technologies that are being talked about, in moving organelles around, in the timing, the synchrony between the cytoplast and the spindle and or the nuclei that are being placed in there, to say nothing of having all of the conditions optimized for what has to be done, and Jacques mentioned this as well. And this is undone work at this particular point, number one. But number two, I think any outcome of your committee has to consider that the number of individuals currently available that have the talents to do this is really minimal. And you're going to have the highest level of some type of regulation or guidance in this to make sure that those individuals in these facilities that are doing this are really capable. That's all I can. I mean, I think you can get a sense of that. But this is more than anything that I have seen up to this point. I can't do it, so that's not a measure of how. Another point that I want to make is that the issue of animal models and the discussion, for example, with the FDA of bringing your animal model your best animal line. One of the things you can appreciate in reviewing where we are in this is the pretty low statistical power of any of the studies that have been done up to this point, particularly in macaques, among other things. When you can't immediately do a lot of animals, terribly expensive. And I would tell you, interestingly, in the report you just heard, I'm a member of that FDA committee that reviewed some of this, I think not as thoroughly as we should have. But one of the recommendations to come out of this, and I didn't realize it until I read the report, was someone put in there that we should be doing all this in cows. Now, you know, all of a sudden you're adding now another dimension to this. I just don't. Maybe someone can remember why this happened, but I don't know. But it's in the report. The concern is, you know, how much animal work do we need, and in what species do we need it? It's something to be considered, and the results that have come out of this up to date. Maybe we can talk about this in the question period. The other issue, and George brought this up, I think, and it's something which we've appreciated for a while, but we really haven't had a lot of data on it. And it's this issue of, in George's terms, the tolerance around the variability we see in many, many parameters that we can measure in early embryogenesis and even later on. I mean, for all of us to come out so normal, it's unbelievable. You know, this is one of the things we are just amazed by, that the kinds of differences we see in our, not only in our genomes, but in the expressed part of that genome that we're constantly measuring. The variability is enormous. But here we all, you know, we're really normal. And so when you begin to look at the types of analyses that you want to do as you're going along, you know, what is normal and what is different? I think we got to be very, very careful as we begin to assess this, and in what tissues we assess it in. A long time ago, we knew when we were looking at anything that was extra embryonic early on, you would find great differences from what was embryonic. And again, so if you're going to look at you know, CVS or anything, I mean, I don't know what tissues will be sampled along the way, but we've got to be a little bit careful in throwing away, you know, something that it could potentially be good as far as an embryo is concerned by just the types of tissues that you're looking at. The last thing that I want to say is that I hope that that your conclusions can be done quickly, because like everything else, there are clinics being set up to do what you're doing, but they're not on the continental United States. And part of this is this misconception, to a certain degree, as I complained so much about the FDA as I went along. They finally said, why don't you join a committee and you can be part of the problem. The issue here is really one of, you know, there is this perception that the FDA is not moving quickly enough on these kinds of things. I think patients are driving this kind of thing. And, you know, this is one of the responses, that they're going elsewhere. And will be going elsewhere to do it. And it would be nice to have some guidelines in place, at least, that we can really move and to do it in, I think, in a timely fashion. So that's all I really have to say. We can talk a little bit in detail later about some of this, but anyway, thanks for the opportunity to chat.
Great, thank you.